Today's conversation, we follow up with Dr. Kathleen Janel to finally understand why your bloating and gut health feels stuck. Dr. Janel has been practicing medicine for over 25 years and is the developer of GI Janel therapy, a root cause antibiotic free approach to resolving IBS, SIBO, and SIFO permanently. With a background in biochemistry and training from Bastyr University, her work uniquely bridges hard microbiome science with real world functional medicine application. This episode builds on our last conversation and goes deeper into the nuance, dosing, detox patterns, and neurological effects that many people are experiencing but rarely get clear answers about. I cannot tell you how many people I've talked to who have done a laundry list of diets and supplements, and they are still so confused about their health, dealing with chronic fatigue, chronic pain, and chronic symptoms still. At Nutrition with Confidence, we do not believe in quick fixes. We help you bio-individualize your diet and lifestyle recommendations and walk you through a step-by-step process that helps you to rebuild your body and calm your nervous system through it. This helps you regain control of your health and build confidence in your ability to heal. If you're interested in finally getting to the roots of your chronic symptoms, schedule a free exploration call at nutritionwithconfidence.com. Welcome back. Thank you, Dr. Janel, for joining me. So we have some follow-up questions to get more into your MSM protocol with your GI Janel 1 product specifically. And so to kick us off, I'm just going to get right into it. I'm curious if you could go into some of the nuance framework around who needs the very high doses and what are some other common doses that are used.
Sure thing. Okay. Well, it's probably easiest to start with bloating symptom, right? Bloating, trapped gas. So regardless of where it is in your body, whether it's up high, SIBO or SIFO, down low, some kind of dysbiosis in the small or large intestine, or generalized, or it moves around, right? So bloating symptoms, trapped gas, those are always going to go up to the high doses. And that's going to be weight dependent, right? So if you're dealing with a child, that high dose might be half the adult dose. And I've talked about that before, about the conversion in terms of kilograms per gram of the GI1 powder that you're going to use with these different size people. But I definitely always want to get an adult who has trapped gas up to that high dose and then hold it there for the full 2 months or 8 weeks, because sometimes it's not going to help eradicate that symptom in the very beginning.
Mm-hmm.
And then it won't kick in until sometimes even towards the very end, in which case I'll usually advise someone to go a little bit longer. So that's not unusual.
Okay, good.
And then when I'm doing an inflammatory, and when I say inflammatory, what I mean is diarrhea, right? Like the inflammatory colitis and diarrhea are all synonymous to me, right? That means that there's that irritation and there's that urgency to get rid of. And so you don't have to go up that high if there's not bloating with that symptom. So if you want, I can talk you through a case.
Yes.
And just tell you about that. Okay. So this is a nice one with inflammatory diarrhea with no bloating. And this is a 48-year-old male.
Do you want to share your screen or not here?
I can, yeah.
Okay.
Well, I can try.
That's okay.
Okay,
If not,
let's see. Share my screen. And then I look at, oh, I can do this. Okay, so 48-year-old male basically has had his symptoms for 10 years, and they started when he was given omeprazole, which is the acid blocker for heartburn reflux. And so during the course of that 10 years, he went to see a lot of different doctors. He tried a lot of alternative, places like Ayurvedic medicine and traditional Chinese medicine. Naturopaths and medical doctors. He had a colonoscopy and endoscopy. Those were all normal. And pretty much the standard of care when you see somebody, first off, they're going to test your stool to go, is there some kind of infection in here that we have missed that's become chronic? That's unusual in conventional medicine for that to happen. It's usually more you get basically like a food poisoning or a C. diff, something like that. You treat it, it's gone. But in my world, oftentimes it's not gone because the problem, the initiation might be gone,
Mm.
but the chronic inflammatory response has been initiated in the body. And so the body doesn't know there's no longer an infection.
Mm.
What the body is on this feed forward inflammation. So that's what we really want to stop. Of course, I always do diet with people because it can easily be something they're eating that's
Mm.
making this symptom either worse or is entirely responsible for the symptom. And just a quick segue, just at the end of my morning this morning, that's exactly what I saw was this lovely 81-year-old lady who just can't eat dairy, and she's heartbroken because we just, after sort of the process of elimination, we found that this is really what the problem is for you, is you really just can't eat dairy. And
Yeah.
she was happy to be able to have had her life up to 81 years old consuming dairy, and she's willing to go without it, but she didn't
Yeah.
like the plant-based ice creams.
Yeah.
So, that to me is so foundational. And this is what I teach the doctors when I'm teaching them, is that you have to start with diet, because if you dive in right away with treatment and you miss the diet, your patient is never going to get better, even if they don't like the news that they
Mm.
can't eat a certain food, or at least, for the time being, can't eat it. So this guy kind of had a mixed diet. He was avoiding dairy himself, and he did a little mix of fast food and farm food. So it looked pretty clean overall. And then when I first saw him, this was his report. He woke up every morning between 3 and 7 a.m. and had diarrhea 5 times. So up and down out of bed.
Mm.
He would have abdominal pain in the mornings after all this, which is understandable because, that's not conducive to a settled system. And he had a lot of gas. So he had burping. He also had flatulence. And his pattern of bloating is a very classic one. He would, after this whole morning episode, would be okay for a while. Then the bloating would start during the afternoon, worsen and worsen, and be at its worst while he was sleeping. And then the cycle would start again, up running to the bathroom. Comorbidities, I don't think we need to get into that.
Mm. No.
So what I did with him is I retested his celiac because his endoscopy and colonoscopy had been about 6 years ago. I just wanted to make sure that hadn't kicked in. I did a fecal calprotectin for the same reason, to see, okay, did he start having some kind of inflammatory bowel disease or
Mm.
microscopic colitis in the meantime? But those were normal. So all we did was I had him start my sulfur formula, half a teaspoon for 7 days, and then one heaping teaspoon, 5 grams ongoing. And I also had him, just for kicks, do a challenge with wheat and eggs, just in case those were a problem. And they turned out to not be a problem.
Nice.
So I saw him once he'd been on that 5 gram dose for a few weeks. And he told me that his stools were formed. They were once a day. He wasn't having any bloating, and his abdomen was still tender, but that absolute, cramping pain was gone, which is
Mm.
understandable too after, 10 years of having this symptom every day. And so he was again one of those people who said to me, why haven't I done this already? Why is this something that no one's given me before? Which is why I started talking about this.
Wow, that is incredible. This symptom of bloating, and that pressure and your clarity of just saying wherever it is in the body, and then along with the loose stool, the IB, the inflammation, like this kind of case, um, I I am curious if someone starts to get a little bit of this symptom, and it's like when they start taking the MSM, they start to get that pressure or more bloating up further up in the digestive tract, kind of returning, like if they had had that symptom before and then it kind of returns. Is that also pretty normal? So it's kind of in this category of, the bloating comes, but it's not as bad as when until they start the MSM protocol.
100%. And the reason for that is what the studies show is that at the low doses and the initial doses, it's a prebiotic. So
Mm,
it's indiscriminately feeding everything, the fermentation species, everyone that's in there. It's feeding all of those guys. So if you have these residual fermentation species, you're actually encouraging their growth and their gas production until you get to the higher doses and hold it. And that doesn't necessarily mean the 30-gram, full dose, but somewhere
mm,
in that titration up in dosing that goes away. And these are things that are counterintuitive,
yeah.
you know, um, but I definitely consider them a really, really good sign.
Yeah. So that dosing schedule that you gave this case, particularly because he was having the loose stools, you ramped him up pretty quickly. It looked like within 7 days, going up to the tablespoon, right? Or was that a
No,
teaspoon?
no, he
Sorry.
only went up. His top dose
Oh,
was 5 grams,
oh,
which
yeah.
is a teaspoon. So that's all he did.
Oh,
And
yes.
that's,
Okay.
to me, that's important because
Mm,
one, I'm not getting at fermentation species. So I'm not really trying to shift the microbiome that much with
mm,
somebody like this. And he didn't really have a lot of trapped gas. What I'm trying to do is use it as an anti-inflammatory so we can
interesting.
settle this, and
Mm-hmm.
that sort of plays along that whole concept of something started a chronic immune response,
Yes.
and that something is long gone,
Mm, mm-hmm.
most likely. Otherwise, somebody would have found it,
Okay.
after all those different doctors.
Yeah.
So he's now in a chronic inflammatory response. The first rule out is food. And if that's not what's happening, then I just want to calm down the inflammation.
Yeah.
That's not how I started out using the GI1 powder. I started out using it exclusively for bloating, but because I use it every single day with all these people all over the world,
Mm-hmm.
what I started to realize was that, hey, at this lower dose, it's actually giving people relief from intractable diarrhea symptoms. And that's when I started to use it more with those particular symptom pictures.
Awesome.
And if you don't need to go up to the full dose, I mean, that's absolutely fine. If you're not dealing with bloating, you don't want to do that microbial shift internally,
Mm-hmm.
then, patients are happy not to go up to the full dose because, the
Yeah.
taste is not lovely.
No, definitely. But so, yes, so that low dose is primarily for that inflammatory set off that can occur for a lot of people, travelers, diarrhea, food poisoning, something sets that inflammation off. Oftentimes you can correct it through diet changes alone. And if if then not, then or combined, likely you could use the 1 teaspoon lower dose. But if they also have a lot of severe bloating still, to keep going up to that
Yeah,
high dose. Okay.
exactly. And here's an example of this, that
Okay.
same exact thing you just talked about. So this is a person who's actually been diagnosed with ulcerative colitis. So she's got inflammatory bowel disease, and when I saw her, she had failed pretty much all of the biologics. So she had failed Remicade, Humira. She was currently failing Entyvio, and she was pending her insurance approval for Skyrizi. And these biologic medications, they're life-saving, right? I mean, not everyone has to use them, but honestly, I was not sold at first when they first came out. But, if it means that you can actually live your life and they're working, then so far that's probably the best thing that we have. And it's better than a blanket
Right.
corticosteroid treatment that we used to
Hmm.
use, right? Even
Absolutely.
though obviously it's suppressing the immune system. So I think people are well aware of that at this point. So when I first saw her, she was having 10 bowel movements a day. Basically, one of the people that just don't leave the house, right? Abdominal pain, gassy bloating, and because of the inflammatory bowel disease, she was having bleeding. Whoops, I didn't mean to go that far. So she was having bleeding. So I started her on the sulfur protocol with the GI1 powder, 2.5 grams, half a teaspoon starting, and then titrating up by that same amount every week to get her up to 15 grams.
Okay.
And that was intentional because she has this inflammatory underlying condition. I don't want to push it too hard. I want to find a dose that's going to land for her.
Okay.
So I saw her in September of this year, and what she told me was that she was having two bowel movements a day. They were formed ish. She stopped waking at night with the gas. The blood had stopped. The mucus stopped passing in her stool, and she didn't have any more of that lower or mid abdominal bloating. She was still having gas and, burping and flatulence. They were better. And I'm happy with that. If she's happy with that, I'm happy with that. It's much an improved picture. So in
Right.
this case, I went halfway up, so that we could
Hmm.
handle the fermentation. When I say fermentation, I mean gas, right?
Right.
Fermentation means gassy symptoms. Something is metabolizing inside the digestive system and releasing gas, so yeast or bacteria.
Hmm.
So in her case, we checked in at that half dose. Had the bloating not improved, I probably would have tried to go up a little bit more. But since it did, then we just stopped there and she maintained that and she's been doing well with that
Okay.
dose.
So this is a dose that is something maintainable. It's kind of not something to come down on, or this is a recent client, so she's still in the midst of it. Is that right?
Yeah, I mean, I want to keep her on this dose for a good solid 12 months before we change anything.
Okay. Yeah, good to know. So you
Yeah.
can maintain these higher doses of MSM safely for longer periods too. That's
Yeah.
awesome.
Yeah.
You had mentioned a little bit ago the studies. Can there some studies done with the usage of MSM for the gut with IBS and IBD? Did
For
you,
for the microbiome, you mean?
yeah, for the microbiome.
Yeah, for sure.
Awesome.
Let's find that for you.
Awesome.
Just need to flip through a little bit.
Because I was talking to my husband about this protocol,
Mhm.
and I was shocked, after talking to you, just like that client has said, how is it that nobody has yet seen this or used this, and that why aren't doctors more readily utilizing MSM? And he was like, "Oh, it's simple. There's no research." And I was like, "Wait, but I think there could be, but there's still probably needing more." But go on, go ahead and share those.
Sure, I will. I want to talk about that for a second, though, because this is such a strange trajectory of how this all came to be. The fact that I was really helped by this after 10 years of having these same symptoms that I'm seeing people for. And it was the first thing that ever worked, and it's stayed eradicated for 20 years. So I started using it with my patients, right? And then the whole SIBO thing started happening sort of in my peripheral vision, right? But I
Right.
didn't really pay attention to it because I'm like, this is what I do, right? And so it wasn't until I started seeing people that were failing the standard SIBO treatments that I started using this and then they were getting better.
Mm.
So I feel like I'm sort of this like lone planet calling out into the
Yeah.
universe and saying, hey, you guys,
Yeah.
you should
Yeah.
take a look at this because it's real. I mean, nothing is 100%, right? Nothing
Right.
is. ever a panacea.
Mm-hmm.
But for me and for the doctors that I do have using this and nutritionists that I have using this, I'm just
It's
getting the
incredible.
same kind of results back from them that I've been getting,
Mm-hmm.
for the past couple decades. So it's great. I even,
That's awesome.
there's a nutritionist in Hawaii who's been talking with me, and same thing. She's like, this is amazing. And it's
Yes.
great because she doesn't need to prescribe anything.
Right. It's
Mhm.
amazing. Yeah, that's fabulous. Okay,
Okay, so
good.
here we've got, let me talk you through what this slide says. So, yeah, this is measuring the time of contact of the MSM with the organism over 30 days. And this is a 50% dilution, which is kind of, I think, explains why you have to go up to the high doses in order to get the effect that you want. Okay, so left
Wow.
side of this screen is the tested species. So we've got Aspergillus, which is a mold. We've got Candida, which is the most common yeast you're going to find in the gut. We've got E. coli, which is important because that's the bacteria that SIBO started out with, was E. coli. That's what Xifaxan is meant to treat, is E. coli, right? Back
Yeah.
when it was initially being used for the traveler's diarrhea, for the IBS-D.
Mm-hmm.
Then you've got Pseudomonas, which is another one that comes up a lot for in-stool tests when people are having these pathogenic species or potentially pathogenic species. You've got
Yeah.
Staph aureus, which tends to overgrow as a commensal, and you've got Salmonella, which again can come up as a non-commensal.
Mm-hmm.
All right. So here's what's interesting to me, and here's the part that we were just talking about prebiotic at the early doses. Okay. So
Mm-hmm.
in the initial inoculum, it's important for your listeners to just pay attention to that 10 to the power of, right? That's an exponential. That means that we're not just looking at the first number, the 3 here. We're looking at to the power of 10, right? So that's what makes it a bigger change in either direction. So after 48 hours, we didn't have much change. Aspergillus 3.5, it went up a little bit, prebiotic.
Mm.
Candida, it went up a little bit, prebiotics. It went from 2.5 to 2.8, both to the power of 10. E. coli stayed the same. Pseudomonas went up a little bit,
Mm.
1.8 from 1.5, both to the power of 10. Staph, looks like it actually went down a little bit, same power of 10, 5.5 to 5.4. And then Salmonella went up, right?
Mm.
So
Mm-hmm.
that's the prebiotic effect at the initial and lower doses. Then that pretty much stays consistent. So I won't bore everybody with 3 days and 5 days. But
Mm-hmm.
once you get up to 14 days, 2 weeks, that's when you start to get a drop. So now for the aspergillus, we've got
Wow.
2.3, but the power has dropped, right? It's not the power of 10 anymore. It's the power of 3. That's a decrease by hundreds of levels, right?
Yeah.
That's what that power of 10 means. Candida goes from 2.5 to 1.2, power of 5 to power of 3.
That's
E.
awesome.
coli, same thing, dropping down to the power of 3. Pseudomonas, power of 3. And these are colony forming units. That's what they're measuring. And they
Mm-hmm.
did it not just on one plate, right? Because this is, you grow it out on a plate, you add the thing you wanted to kill it, and then you put it in an incubator and you watch.
Mm.
So they did this over several different inoculations in the incubator. Staph goes down to power of 3. Salmonella goes down to power of 3. By the time you get to 20 days, you can't find any.
Wow.
And
That's
that's
incredible.
consistent all the way out to the 30 days.
And the dosage at that 14 days is
So this is a little bit
variable.
different, like to translate, right?
Yeah.
Because this is dealing with not an in vivo study, not a
Mm-mm.
human
Mm-hmm.
person or an animal. It's an in vitro, so it's on a plate, right?
Okay.
So
Yeah.
what they're doing is they're doing a 50% dilution in, I believe they use water, so water
Okay.
and MSM. So it's quite strong.
Yeah.
But I'm comfortable with the 30-gram dose doing the same job
Yeah.
as this experiment shows.
Yeah.
And let's see what they say here. A media was inoculated for 1 month, during which time the organisms were added. and enumerated to determine if they were growing, dying off, or remaining near the inoculation level. That's what we just looked at. And then the
Hmm.
data points where they measured it for colony counts on those specific days.
That's amazing.
I love
Okay.
this study. This study
Yeah.
changed my life because it gave me something to um, basically quantify what I'm seeing in practice.
Right. And so we had talked about this fermentation that's going on in the last podcast, and that when we have these overgrowths that are happening, these are over fermenters. There's others probably too that weren't in this study. And you talked about this transformation of the gut that can happen. So it's almost like this redistributing of that balance of good bacteria and bad bacteria, bad quote unquote. But uh, do we have studies that show that the MSM isn't killing the good bacteria at the higher doses too? And I guess this a second question there then is, when we're doing the high dose, do you not recommend to do, because it's antimicrobial in nature, do you not recommend to use probiotics at the same time?
That's a good question. And I think it's probably a personal um, decision, because personally, as the doctor, I tend to stay away from probiotics when people are backed up, constipated, because I find that it slows things down.
Mm-hmm.
And I'm just thinking about back in the day, like, 30 years ago, where you could not get a probiotic without fructooligosaccharides in it. And
Mm-hmm.
that was just nightmare to these
Mm.
people with fermentation issues, right?
Yeah.
Now,
Yes.
we're obviously more aware of that. We can get them. So if somebody has some kind of inflammatory diarrhea happening, whatever their diagnosis is, and they want to use a probiotic, I don't have a problem with that.
Right.
If they're constipated, I'll probably talk to them about that first and say, this might not be helping us in the long run, because one of the main things I want to see with my patients is a daily complete evacuation when they're
Yeah.
going through this protocol. I don't want anything backing up.
Mm-hmm. Mm-hmm.
And sometimes too, people think they're bloated with gas when they're really bloated with constipation.
Yes.
So that's something that we really just don't, want to discourage that from happening.
Mm-hmm. Mm-hmm.
Um, I
And
don't know
that,
if,
yeah,
go ahead.
well, that pairs into, some people just don't tolerate probiotics too because of that
Hmm.
mucosal lining, and how we need to kind of establish first this barrier,
Hmm.
healthy intestinal integrity. And we can do that with the MSM pairing nicely with that. And I guess second question with that is, do you ever pair MSM with things like immunoglobulins to help with that intestinal lining building? I know there's the slippery elm and marshmallow root in your product, and the acacia, so that helps with butyric acid and healing the lining of the gut pretty nicely. But do you ever see the need to add other beneficial mucosal building supports?
I think it's a great idea. I don't usually do it
Hmm.
just because I want to get results and I want to be really specific about how we're doing that. But obviously I love things like the arabinogalactans and all of the other immune stimulating type formulas. If someone's already on them, so I know they're tolerating them okay,
Hmm.
then if they
Hmm.
want to stay on them, they can stay on them.
So,
But it's not something I naturally gravitate towards just because I want that really pure data. Oh,
right.
this is the only thing we changed, and this is the result that we got.
Hmm.
So in terms of, data looking at, oh, wait, let me go back for a second.
There
I want
was
to talk
the,
about,
yeah, the
uh,
probiotics.
yeah,
Yeah.
yeah, probiotics I want to talk about because um, I might have a little bit of different take on probiotics than your
Hmm.
average functional doctor. Our, let's just talk about the large intestine, the colon. That's because that's where the probiotic action is, right? Not so
Hmm.
much in the small intestine. So, we know that there's lactobacillus, we know that there's bifidobacter, and we know that there's all of the subspecies strains of those. But there's a lot of other
Mm.
um, bacteria in there.
Right.
And, there's a couple other that we can add into those two, right, with the strep, thermophilus, and the Akkermansia. But it's very limited relative to, the data is like up to 700 different species in our colon. So I feel like using a probiotic, you want to see results,
Mm-hmm.
right?
Mm-hmm.
And if you're not getting any changes using a probiotic, then I don't think it's like a multivitamin kind of conversation, right?
Mm-hmm.
I want to
Mm-hmm.
see it do something for the patient. And if not, then are we just giving them something that either they have already or
Mm-hmm.
that's not going to populate for whatever reason?
Right.
Or you just need a different kind of microbial balance in there. Maybe there's a subspecies that we don't even know about yet that is only there in like 0.0001%, but it's integral to
Right.
keeping the communication going between all of those more abundant species.
Right. I love that you're saying this because I love to look at ecology, systems of soil health and microbiology and like nature. We are nature
Mhm,
and we only know so much about these communications between fungi and bacteria. I think we talked about this last time, but it's just
mhm,
there I used to talk about I actually used to tell my clients more that I steered away from using probiotics because they are kind of like a nuclear bomb in our gut in a way. Like we don't fully know the repercussions, the ripple effects of what
mhm,
we're introducing. And I know some people who are so reactive to different strains of bacteria that come on the market and
mhm,
luckily it doesn't stick with them, but it could, sometimes if you're taking a probiotic for long enough. But now these days, I think there are some key strains that in products that I have used and have seen results with uh, in specific cases. And yet we just don't know enough yet. And those strains are my favorite is Bacillus subtilis, which is not, it's just kind of, making space. It's not like the way I think is interacting with our guts, that there's like a common theme here in our society where there's overgrowth of bacteria and we are missing some keystone species. So I see it as a bacteria that's creating some space to allow for better uh, balance of the good bacteria to come in without us having to actually plant them ourselves, because that's like playing God to me.
mhm,
And I'm not that powerful. I don't think
mhm.
we're quite there with our knowledge base yet with planting.
Absolutely. Yeah,
Yeah.
I agree. I agree. I don't think we're there with the knowledge base. We don't know how they interact with each other. We know percentages. That's what we know.
Mm-hmm.
But and even that is like, is this a healthy percentage? Is it not? We
Right.
just, there's so much. But then when I see things like people being marketed probiotics because this particular one is good for your ears or this one's good for your nails, it's like we don't even know what they're doing inside of us. How
Mm-hmm.
could we possibly know that these particular ones are good for various other organs in our bodies? So
Mm-hmm.
there's a little bit of overreach, I think.
Mm-hmm. Yeah, it's good to be cautious for sure. And I've that leaned more in alignment with looking to cultured ancestral foods to kind of provide those for us. And,
Hmm.
that's, that's how we would typically have gotten those. And if we need more, yeah, I think more research would help
Hmm.
give a lot of illumination. It is quite fascinating I have people put like yogurt topically on their skin with the strep thermophilus probiotic in it, and it's like or L reuteri, and like their skin is like so clear and it gets like more elastic. It's kind of cool, to see some of those things improving for
Mhm.
people, but I don't know why. There's so many other reasons it could be helping people.
Right. And no harm done.
Right.
Like
With adding
it's not
yogurt.
like yeah, it's like put some yogurt on your skin for a couple of days. It's not going to damage anything. I've definitely done that for people that have, chronic vaginal yeast infections, use
Yes.
yogurt,
Hmm.
especially if we're somewhere where there's nothing else.
Yeah.
Yeah,
Yes.
I've definitely done that, and it's helpful.
So you don't think that the MSM is going to reduce the numbers of the good bacteria, though? Is that
So based on symptoms, no. I've seen a few post stool tests and have not seen any problems with it in
awesome?
terms of that, right? So looking at cultures and PCRs, in the culture testing, you almost never get, lactobacillus growing out because it's such an obligate anaerobe that it gets killed in transport. So the PCR is helpful for
Hmm.
that,
Hmm.
measuring dead species, quantity of dead species. But
Yes.
I've definitely seen if I get a panel in, for example, and someone is, let me just actually see if I can find that for you.
But yeah, the seeing pre
Here we
and
go.
post stool tests are definitely something I want to start running a few of my clients with this protocol just to be, just to keep solidifying for people that this is an amazing,
Yeah,
uh,
please share that data with me when you do
yeah,
it. If
absolutely.
I could get, one of the functional labs to just do it for the patients, like be part of this experiment with us.
Hmm.
Oftentimes, they're like, I don't want to spend another $600 on a stool test kind of thing, right? And I'm like, I get that.
Right.
I
Yes.
get that. So here's the ones that I made a list for you that I've seen come down in either the PCR or the culture. Klebsiella, Pseudomonas, Citrobacter, Enterobacter, Rhodotorulea, which is a yeast, and then other Candida species, with no
Fabulous.
real major impact on the probiotic species or the very much commensal species that you want to have in there.
That's fabulous. Okay. Well, then let's get into some side effects that a few of my clients have experienced, and it's not everybody. And we dabbled in the skin flares that can happen, or
Hmm.
sometimes
Hmm.
other returning symptoms, like you've talked about in your book, having some, what are they called, ulcers in the mouth kind of return, but one of the big ones is the skin flare. I have had a few people with the small titration dose
Hmm.
have massive rash on the skin, um, increase, actually it might have something to do with that prebiotic effect with the small dosing. But if that was to happen with your clients, like what do you usually do for them? What do you recommend at that point? And why does
Well,
it happen?
yeah, well, I don't know exactly, but I have
Mm-hmm.
some ideas, right? Right now, I'm at a theoretical place, and hopefully, I won't always be there. But
Mm-hmm.
one thing we talked about before was building up the mucus lining so that you weren't getting direct contact between the prebiotic species and the cells of the gut, creating that histamine reaction, right? Mast cell activation,
Mm-hmm.
kind of thing. That's one reason. Another reason can be once you've been on it for a while, this wouldn't happen initially because you have to give the body a chance to be able to take the MSM and convert it into the sulfur cycles, right? It has to enter as methionine. And there's some evidence that our gut bacteria can do that, metabolism and make that methionine feed into the sulfur cycles. And so once you've done that, if you're really pushing them, then your sulfite oxidase has to be working really, really well to move any kind of sulfite to sulfate, right? Because sulfite
Mm-hmm.
is one thing that can cause very much like a histamine reaction. If you look at the
Mm-hmm.
reactions to sulfite and you look at the reactions to histamine, they're almost identical, right?
Mm-hmm.
So either one of those two or both could be happening. but no one has a deficiency, like 100% deficiency in the sulfate oxidase enzyme. You wouldn't survive.
Mm.
And everybody, even if they're not taking extra sulfur, is that cycle spinning all of the time, right?
Mm-hmm.
So it
Mm-hmm.
is working. We know that it is working. So extra molybdenum can help people upregulate that cycle. And it also might just be an acclimation to the methylsulfonylmethane itself, right? Because
Mm-hmm.
it's absorbed intact.
Mm-hmm.
And I don't have that slide up right now, but it's absorbed very quickly, like within 1 to 2 hours in the human studies and the mice studies, distributed throughout the body. It literally goes everywhere. It goes to the brain, it goes to the nervous system, it goes to all the organs. And then over a sustained period of time, what you get is a steady state in that. So now you've got the anti inflammatory and all the benefits of that MSM throughout your body. And I think that once people get to that place, that steady state, that's where those symptoms go away,
Oh,
right?
okay. Yeah.
And then, your natural cycles are to um, take in sulfur, have it go into the sulfur pathways, have it be used for all the things that it's used for, taurine and acetylcysteine, and for transport. That's a huge one.
Mm.
Sulfate has to be tagged onto all of the ring structures in our body in order to make them soluble for transport. So that includes
Mm.
cholesterol, vitamin D, phenylalanine, all those things. And then it transports them, and then it gets dropped off in the kidneys and
Right.
peed out. So there's this constant input, output, input, output. And that's why I
Mm.
say you don't store sulfur.
Right. Mm-hmm. Right. But it's being used. It's kind of stored in the collagen makeups of, yeah. Right? Is that you wouldn't
It
call it
is, but it's
stored?
not the same like calcium bone storage kind of concept, right? It's not like you're going to go, your body's not going to break down collagen to give you sulfur if it needs it.
Okay. Right. Yeah. So it's not a backup. There's not a backup system to kind of supply that.
That's a good way of putting it. Yeah.
Okay. Yeah. But so if would you say another thing could be helpful for that skin? Whenever I see skin issues, I'm always thinking clear those detox pathways because it's a major, I'm a skin detoxer and some other people are big skin detoxers and I think it's because liver is congested. I have the NTHFR mutation. Other things might be at play. I've had a history of chronic constipation, so just like a constant recycling, so the sluggish. Um, you in the past, like typically just more sluggish with that, so then my skin would have to make up for it, and
Mm-hmm.
then kidney support potentially, like just increasing hydration. Maybe homeopathics to support kidneys might alleviate some of that skin flare. Also, do you think
Mm-hmm.
it? Yeah.
Yeah,
Any
I mean,
other?
you're basically describing the evolution of naturopathy, right?
Mm-hmm.
The
Mm-hmm.
idea that we have to open those emunctories is the old word for them.
Mm.
There was a doctor out of Oregon who, Tom, Tom somebody, I
Messenger?
don't remember. Pardon me?
Messenger? Is he a naturopath?
No,
No. Okay.
I can't remember. I think it was Tom Dick or Dick Tom. Now I can't remember which was
Oh.
his.
Uh-huh. First name. No,
Yeah,
I don't
he
know.
was really into like the old school naturopathy. So everyone got castor oil packs every night.
Yes.
And then he worked with those homeopathic formulas to open up all of the clearing systems in our skin. Like you
Mm-hmm.
said, the kidneys, the liver, I mean, sorry, in
The
our
lymph.
bodies, the kidneys, the
Mm-hmm.
liver. And yeah, I mean, it's reasonable to put that into the differential diagnosis when someone has a skin rash
Mm-hmm.
that something's backing up somewhere,
Mm-hmm.
um, and or their skin is just being irritated by whatever we're putting in there. Because, what I've seen, I'm not sure if you've seen this yet in your practice, but what I've seen is they go away.
Mm-hmm.
Those side effects go away over time. So
Mm-hmm.
something is happening either with the microbiome,
Mm-hmm.
with the other emunctories, with the metabolic cycles, with the mucus lining, with the repair, or maybe all of it.
Mm-hmm. Yeah. Yeah. Interestingly, one of those clients, we found out she had previously remediated her home, but she's actually still in. And, mycotoxin impact current during that MSM is just, it's going to mess with the immune system, right? Those mycotoxins really impact our skin, kidneys, liver, detox pathways. They just make it sluggish. So it makes sense that her body would express that in that way with like a therapeutic treatment that's kind of getting at that root. Um,
Absolutely.
yeah,
Yeah.
that
And
makes a
that's
lot of
actually a
sense.
good segue into what is the MSM doing in terms of the neurological system.
Yes, let's talk about that.
Okay, well, I'm going to pop up another slide here for you.
Good. Yeah. So my question I had sent Dr. Janelle earlier was if we could talk more about how MSMs or sulfurs function in the brain, impacts neurological conditions and also potentially symptomology.
I've also got a case on this, which is a mold case if you want to get into that.
Great.
Um, this might be a little more than we need in terms of the sulfur cycles. But what this
Hmm.
is basically saying is that methionine is the feed in, that's an amino acid, right, for this entire sulfur cycle. And then what it does is it cycles around and creates acetylmethionine, homocysteine, cysteine, glutathione, iron clusters, coenzyme A, hypotaurine, and taurine. And then it gets a little bit into transport. We don't need to do that. But I really like this one. A deficiency of sulfur has been shown to compromise glutathione synthesis. During an immune inflammatory response, a combination of enhanced utilization of cysteine to make glutathione and cell
Mm.
replication may be what leads to depletion of cellular acetylmethionine, right? So what
Or
you're doing is
SAMe.
you're using that glutathione as a detoxification, which that's what it's for. One of the main things it's for. And then that's in turn giving you a depletion in, in quotations, your sulfur stores, but the sulfur cycle pathways, and just reinforcing the idea that neither cysteine or methionine are stored in the body. So anything excess will oxidize it in that pathway, that sulfite oxidase pathway, to sulfate, and then it'll get peed out through the urine. So you can kind of think of glutathione like you were talking earlier. It's not a backup, it's not a reserve. But, if we have extra glutathione in our bodies, that's wonderful because if we get
Yeah.
into an oxidative stress, then we're going to need it.
Hmm.
Let's see.
I think there was a comment on the last podcast that was saying, "Oh, if sulfur is so important, why doesn't the body store it?" But there's in nutrition, we have a long list of, well, there's essential amino acids. Those are essential because our body, like methionine and cysteine, cannot make them. And that means that's why we have nutrition. That's why we have to eat things. So it's kind of just think about it like that. Like there's definitely a need for this sulfur, and it's not bad that our body doesn't hold on to it, but if we can have extra of it, especially if we have low glutathione, if we can get extra of that, that'll help us make more glutathione is what I'm seeing. That's what that says, right?
Correct. Yeah.
Okay.
Because we can make it if we have the raw material. If we don't have the raw material, we can't. And
Mm,
so then the body's just going to likely build up those chemicals that are meant to be detoxified by glutathione.
right.
This one is This was a study that was done on immune compromised people. I think these were HIV patients, but I think it's worth looking at least the mechanism they discovered that the oxidative stress. So let's just say it's a mold toxin, right? Instead of saying oxidative stress, we'll say mold toxin because that's what it is, right? And how it's related in terms of glutathione. So they noticed a decrease in glutathione due to this mycotoxin related depletion. So either the mycotoxins are actually able to suppress glutathione synthesis somehow, and or you're utilizing them up too much. So either way, you're going to have less glutathione than is ideal.
Mm-hmm.
And so they're seeing that this can contribute to the range of symptoms, right? And you brought up the skin stuff. When I first learned about mycotoxins and mold, it was like a door opened, and all these people that would come in with these skin issues, it would give them glutathione, and it was amazing, amazing clearing of problems.
Mm-hmm.
Um, and psoriasis was one of the ones I found was really targeted for a lot of people with glutathione, just a simple oral glutathione,
Mm-hmm.
um, liposomal. And in some of my research, I found that there's now actually cellular glutathione transport receptors on the enterocytes, on the small intestinal cells. So, you know how I wrote in my book that everything has to be broken up into its individual building blocks to be absorbed? That's true. And this is sort of newer information since I wrote that. So there's
Mm-hmm.
glutathione receptors on the enterocytes. So it may be able to be transported across into our
Absorbed.
body intact rather than broken
Mm-hmm.
up into its three amino acids.
Amazing.
So what they're saying here is that the lack of function of these enzymes or glutathione depletion um, requires administration of glutathione for these people to make them feel better,
Mm-hmm. Yeah.
basically. And
Right.
here's one guy that I treated. Let's see, was it 2021? I think it was 2021 when I first saw him. So this guy was sick. He was so sick, he could barely work. And the contamination was in their house and in their car. So when they had the inspection done, they found that there were 10,000 times in excess of the allowable limit of mycotoxins. So they remediated everything, but the problem was still inside. And this wasn't a colonization problem. This was still from the outside, mycotoxins within this guy's system. So he had the rashes, the dizziness, the chest pain. He was extremely tired and starting to get arthritis in lots of different joints. And his allergies were also going off the charts. So prior to my visit with him, he had tried some of the binders, and he tried some NAC, which made things worse. And that was kind of a clue to me. And he'd had 4 of the urine tests previously. Gliotoxin was his worst thing.
And that
Uh,
means that one typically does mean, I think, the colonization of the gut, right? There's more systemic colonization going on with gliotoxins.
yeah, I don't know if this was really the case for him.
Okay.
And honestly, he did have this whole list of symptoms,
Hmm.
but nothing GI and nothing sinus.
Yeah.
Those were
Interesting.
fine.
Yeah.
And so I didn't actually run a colonization study on him,
Okay.
just because I wanted to clear this whole mycotoxin picture first and then see what we had left over.
Mm.
And then, some of the other things he said, he couldn't go into his garage. Oh, yeah, they went and stayed in a hotel at one point overnight, and the hotel had just done this big revamping.
Mm.
It was that one up, up in Blaine. And what's that little area? It's an Indian reservation off of Blaine. Do you know the one I mean?
I don't. I'm
But you can
sorry.
see Canada from there.
Oh,
Anyways,
wow.
so they
Nice.
stayed there. They had just done a big update. I know because I'd been there just after too, but he was so sensitive to all of the new chemicals and all of the, new
Mm-hmm.
carpets and paint and all that stuff. They had to leave. He couldn't stay there. And this is one thing that Dr. Campbell, the guy that is the director for the My Myco Lab, talks about is that gliotoxin and glutathione can potentially cause more problems for people. And there is one study that talks about
Mm-hmm.
that. So it's like, okay, well, maybe this is not the direction we need to go into. Oh, yeah, here's the study. This is the glutathione
Oh.
with the gliotoxin induced cytotoxicity in human neuroblastoma.
So glutathione makes it worse. The the impact to the brain.
hmm
Okay.
And this is, in people with neuroblastoma. So that's a very specific diagnosis. But they did find that when they added glutathione to a gliotoxin, induced toxicity, that it actually made things worse.
Mm,
So he kind of
right.
warns against that. I don't find that in everybody.
Hmm.
So here's what I did. It's like, you know what? Let's use the GI1 powder and see if we can get these sulfur cycles and you can make your own glutathione
Hmm.
endogenously and help out with that. So he was one of those pinch dose people. We just did a tiny, tiny bit and it took a very long time. It took him 60 days to reach a half a teaspoon.
Mm.
And at that point, he didn't notice symptoms improving. And then we did another 60 days and he got up to the 5 grams. And that's when we started to see things changing for him.
Oh man, this is
So
awesome.
so he just continued that 5 gram a day dose and did binders to make sure we weren't getting that recirculation back in. So yeah, check in 12 months later. He was able to mow his entire lawn. He had 2 acres. He could work an entire shift at work, and he and his wife started getting their retirement plans back on board because they wanted to build their retirement home up in that same area where that hotel was. But he did say he felt, back to his normal self and wasn't having the rashes, dizziness, chest pain, none of those arthritis and disease stuff. So, what I think happened, and again, we just have to put, the pieces together.
Mm.
I think he was actually able to manufacture his own glutathione
Hmm. Yeah.
once his body acclimated to it.
And then he could detox all of those mycotoxins, which the gliotoxin specifically was the highest. And I just want to say, keep going, people. This is such a cool case study to just be like slow and steady, and not give up on something. I think that's always the confusion out there for people is how long do I do something for? And so I just love these stories. My mentor, um, I think inspires so many people, Mary Reddick, because of her story of how she did soups for 6 months to a year, and she had worsening of her symptoms, her neurological symptoms, her increased, but she saw her blood levels improving, and eventually like she hit that 6 month mark and started to feel better. But
Mhm.
it took that long, and I think people just give up too soon, right? But just go slow, steady, and especially in a case like that when you're so reactive, with the nervous system, especially with those neurological impacts from mycotoxins.
Absolutely. And I'm so glad that we know about mycotoxins now. It's
Yes.
not been around for that long, and it's still not on the radar of conventional medicine. And there's a lot of people who are very, very sick
Mm-hmm.
from either inhaling these and not being able to get rid of them or living in moldy homes.
Mm-hmm.
And,
Yeah.
back in the day when it was just black mold, that was it. If you had black mold, that was bad, but everything else wasn't. That's not true.
It's not right. It does behoove us to test now since we can.
hmm
And it's not perfect yet, guys. It's definitely not perfect testing out there, but if you can get some data, it really does help, I think. So with when we have someone like him who has neurological, a lot of neurological problems, that glutathione is really helping the brain. There's that sulfur function there. Are there any other sulfur functions, um, and why it's so helpful for neurological symptoms?
Antioxidant for sure
Mm-hmm.
in the central nervous system.
Yeah,
Do you want to do a mouse study?
sure.
Okay. Poor little mice. Okay, so here's a mice study where what they did was they were trying to make the brain of the mice look like someone with Alzheimer's,
Oh,
right?
yeah.
So they damaged the brain of the mouse with BPA and radiation. A lot of big words, neuroinflammation, right? That's what
Yep.
happened.
That's what happened.
Okay. When they gave these mice at the same time MSM, what they found was that modulated the effects because of its antioxidant properties. So these same mice, they did, I
Wow.
don't think it's in this particular grouping of slides. It might be a little bit further up. Let me see if I can find it because it's really, no, it's not. It's on another lecture. So what they found was that they did, the three test groups, right? A control group that got nothing, a group that got pre-treated with MSM plus the radiation and BPA damage, and then a group that just got the radiation and BPA damage. And
Hmm.
the group that got the MSM treatment prior looked like the control group in the end.
Ah, wow.
Right.
That's
So they
amazing.
looked like the group that didn't get any kind of BPA or radiation damage.
Mm.
So it's it's antioxidant properties. Where's that little slide I was looking for? Yeah, here we go. Here's some doctors to tell you. um, it does a lot, and we know a lot of these pathways already, right? We
Hmm.
know that it inhibits inflammation and inhibits specific cytokines like interleukin 1, interleukin 6, tumor necrosis factor alpha, prostaglandin E2, nuclear factor, kappa beta. A lot of those things I just rattled off, those are the biologic targets for a lot of the new inflammatory drugs, right?
Hmm.
So those
Hmm.
injectable biologics for inflammatory bowel disease, for psoriasis, for arthritis, there's more and more all the time. Those
Hmm.
are the targets that they're looking at. So instead of doing a blanket suppression with steroids, because steroids act higher up in the pathway, right? So if you use prednisone, you're going to just lock down all of these. None of them are going to work. But with the biologics, you're specifically looking at these, and
Amazing.
MSM targets those as well.
Yeah.
So
Yes.
that's the anti-inflammatory, antioxidant through increased levels of glutathione, superoxidase, dismutase, and catalase.
Hmm.
And they also showed in this particular reference that it was able to reduce homocysteine, and that in turn reduced damaging collagen cross-linking.
Hmm. Wow.
So a lot of different really good
Good.
things that it does.
Yes.
It's almost too simple.
Right? It's just
Right.
one of the most, like you said, fourth most abundant, nutrient that our body does
Hmm.
need a lot of. And you show on your website that, it's kind of maybe suspected now that sulfur deficiency is a lot more common and we can't really test for it with a lot of tests aren't testing for it.
Yeah.
So, so actually along the neurologic theme, we have seen a pattern in some of our clients, and one client or one person, anonymous person, had asked about why MSM gives insomnia or makes their insomnia worse. And some of our clients aren't just having, frequent waking or more irritation or like more just like energy. It's like they're just agitated a little bit more, but they're also having like some more vivid dreams. So
Mhm.
what do you think is going on there?
It it comes back to the same theories as the histamine actions I talked about earlier, right?
Mm-hmm.
Either what's happening is that, you're having an increase in mast cell activation because you don't yet have a strong enough interface in the mucosal barrier. It could be direct cell cycle upregulation of the sulfur itself. But I'll give you an example, and this example is what I see, right?
Mm-hmm.
Um,
Mm-hmm.
Pretty much across the board. There's a time where that stops. So this person is a guy. He's in Canada. We had to have a translator because he only spoke French,
Amazing.
and my high school French couldn't cut it. So we his problem was exactly that. I mean, he had these little tiny measuring spoons, one hundredth or thousandths of a gram. Like he could measure it out, and he had a scale and everything. But no matter what he took, he would have that insomnia hyperstimulation.
Right.
So in talking to him, he had the idea. hey, if I'm gonna have it anyways, why not just hit the brakes or hit the gas and start with the full dose?
Yeah.
Because it's gonna happen anyways. So I may as well just get up there quickly.
Yeah.
So that's what he did.
Mm.
And believe it or not, I heard from him this morning.
Mm.
So he's definitely on my mind. And he did get up to the full dose, and that symptom stopped within the first week or so of him doing the full 30 grams.
Amazing.
So
Okay.
not everyone's going to want to do that, right?
Right. Yeah.
And this
Like
fellow
MCAS
was
people. Yeah. They're not,
for
they,
sure.
they don't want to create that symptom for themselves. So we're trying to
It's
not,
yeah,
not have that
it's
symptom.
scary. It's scary.
Yeah.
And I've got, just to corroborate the theory and to help people with the symptoms, then I've got a couple people that were using the chromium sodium, the
Mm-hmm.
gastrochrome on with their dosing, see if we can't dampen down the histamine response that way. And
Mm-hmm.
all of the other antihistamines that are available. But it is a temporary, just like the skin, it's a
Mm-hmm.
temporary reaction.
Yeah.
So whatever's happening in the body to acclimate to that normal molecule, right? Like
Mm-hmm.
there is MSM in pretty much all the plant-based foods. So we're getting it
Yeah.
with
Yeah.
our, vegetables basically. And there is MSM not to the degree of the percentage of distribution that you have when you supplement it at the high levels. But even someone who's never ever taken a supplement, if you look at the composition of their body, it's in there. So it's not something that I'm worried about people having like an anaphylactic reaction to.
Mm-hmm. Right. Yes. Yeah. That's so reassuring, and that, it takes someone with MCAS and histamine intolerance, but like the very um, intense spectrum of it is has to be a very brave person, to try anything and keep trying. I've worked with so many people with this, and that is that's what you have to do, just to keep putting one step in front of the other, and to know that
Mhm,
it's temporary, is really helpful, with
mhm,
this high dose protocol.
mhm. Yeah, and it's worse at the lower doses.
It's worse at the lower doses. That's
All of
interesting.
the things you don't want are worse at the lower doses.
Right, right. You'll get
So
much more therapeutic effects if you jump to it. Yeah.
yeah, if you're willing. And the other thing that I've been using for mast cell activation is the low dose immunotherapy can be
Mm.
really helpful for people. And I actually have some formulas that are histamine, right? So
Mm.
I'm desensitizing people to histamine
Mm-hmm.
when I'm giving them those. And, there are subcutaneous injections,
Yeah.
but they can also work sublingual.
Yeah. Yes. Yeah. Is that would that be along the same lines of using, I've seen a homeopathic remedy for histamines. But would that it's very different, but would that be along a bit of the same line there to like?
Similar theory.
Mm-hmm.
I mean,
Mm-hmm.
the low dose allergy treatment was developed by a medical doctor, right?
Mm-hmm.
And so he didn't come at it from a homeopathic perspective. But what he found was that let me just make sure I got this right. This is a doctor who is over in England. He's long passed, but this is in the 1960s. And he found that when he induced allergies, again in mice, and then gave them beta glucuronidase and very, very dilute formulas of the allergen, there would be peaks of suppression at certain concentrations.
Oh, wow.
So it kind of falls into the homeopathic realm because it is very,
Yeah.
very, very tiny doses. But I don't think that that was his thought process when he developed those.
Right. Right.
Um, so then he developed formulas that are, those exact peak concentrations that caused an antihistamine response to whatever the antigen was,
Yeah.
and then formulated those to use clinically.
That's amazing. My last couple questions. I think we already kind of talked about that there are other chemicals that are not just the glyphosate we talked about, or toxins, I guess, not just chemicals, but other toxins like glyphosate and mycotoxins, but probably a lot of other chemicals are impacting our sulfur levels and sulfur status. Are any major ones that you would want to speak on extra that we didn't?
I think, Dr. Seneff really hits home with the
Mm,
glyphosate. I'm
mm,
sure there are, but I don't know enough about it.
yeah.
But her concept of that, I've listened to your interview with her about 4 times.
Yeah. It's so, yeah, a lot of, it's
So
very
good.
heady.
It's
She,
so good. But I've heard her talk before, so it's sort of built on.
right.
And that piece where she's talking about glycine being able to be, or glyphosate being a glycine analog in the building of our proteins is so brilliant. And then I've actually made a couple of videos on this where if you look at the structure, she is right on. You
Mm,
know, glycine is the smallest amino acid,
mm,
and in many of our sulfur transsulfuration pathways, the glycine is holding on to a phosphate. Well, glyphosate is literally that. Glycine holding on to a phosphate,
looks
you
exactly like
know?
it. Mm-hmm.
Yeah. And so you can see how it can be stuck into the building of amino acid in substitution for the glycine. And
Mm,
then because the the function of those amino acids, if they're enzymes, the structure is function, right?
yeah.
That it has to be that certain shape in order for it to do its job. And if you stick anything in there that's not that shape, it's not going to function properly.
Mm-hmm.
And that's pretty hard to um, it's pretty hard to prove because you would have to, well, I guess they could do it with animal models, right? They
Yeah.
could sacrifice animal models and dig them apart and see, well, excuse me, if is this what's really happening?
Right.
But then it gets down to studies and costs, and I'm sure that, the makers of Roundup don't want to do that study.
Yeah. Yeah.
There's no motivation to do that.
Yeah. There's so much. I think I just got a notification the other day from EWG, the Environmental Workers Group, and they were saying just now, again, like uh, politics are getting in the way of people's health really being um, put at the forefront. So, companies like Monsanto, actually it was Bayer. It's Bayer now, right? So, uh, crazily are not at all being held up to any standards of, or not even getting a chance to people who have maybe been harmed by glyphosate aren't even getting a chance to present their case uh, to confront Bayer. So that's terrible in my
Mhm.
mind. But actually, I have a client that just came to mind about the when he takes glycine, he gets the opposite. Usually it's like a calming, it's a good thing to help with insomnia, anxiety, and he gets anxiety. And I think we've talked about maybe you've talked on your Instagram a video of this action happening of glycine, actually glyphosate getting dislodged through taking even the MSM,
Mhm.
but potentially even just taking glycine. If you get this anxiety from it, you
Mhm.
probably are detoxing glyphosate
Mhm.
because
And
it's
yeah,
agitating to the body.
yeah. Thank you for reminding me about that because I come up with these ideas, and then it's on to
Yeah.
the next. I actually thought of that while listening to your interview with Dr. Seneff while I was at the gym. And I ran home to write it down because I was like, yeah, what if that is what's happening? Is actually you are, because, we can only use an enzyme over and over again so many times. Some of them are one and done, right? And
Mm,
so they wear out. So they get set back to the manufacturing system in our body broken down and either excreted. But in that process, if you have that glycine analog, of glyphosate substituted in there, when you break it down, you're actually going to release that, and hopefully you're going to get rid of it.
Mm,
So possibly that stimulation is coming from that. That's another thing to ponder in terms of what is the mechanism here. And that would actually make sense. Again,
mm,
these are thought experiments, right? That
hmm.
would make sense in terms of the fact that it clicks over and it's gone.
Right. When you get
So
enough, yeah, of it.
once yeah, so if
Hmm.
what you're doing is releasing that stored glyphosate in your proteins, then that is a good thing.
Yeah, absolutely. So, kind of a different caveat is MSM safe, this high dose protocol? It's probably not safe during pregnancy or breastfeeding because it could be exacerbating detoxification. What would you say there?
I always just rely on my medical websites, and there are no data, and so I advise people not to do it.
Yeah. What
And
about,
it might be fine, but there's just nothing to say it is.
right? So not taking extra exogenous MSM at all or doing the high dose specifically.
Correct.
Yeah, both.
I
Okay.
mean, and if you've got ubiquitous tissue distribution on oral intake
Hmm.
and you're breastfeeding,
Hmm.
then you're definitely going to give higher concentrations to the baby. And I don't think that's really necessary.
Hmm.
I actually started out in pediatrics for my first several years of practice with a pediatric doctor. And we were really, really, kept the guardrails up really high with our pregnant mothers. And we really didn't want them taking a lot of extra anything
Hmm. Yeah.
during pregnancy. It wasn't really towards the end, in the last part of the third trimester, where we sort of opened things up and said, okay, if we need to, we can intervene here. But now that we've got really good complex fetal development, right? But in the
Mm-hmm.
beginning, multivitamin and fish oils, and that was it.
Yeah. Yeah. That's good to know. And then I think why I wanted to ask a little bit more about if well, first off, is if you know of if there's a different metabolic function um, of sulfur in the pathways in our body based on the body's different states, like being in ketosis versus glucose burning in the mitochondria or in other areas. Well, not that it's in the mitochondria. Well, yes, it is used in the mitochondria pathways.
Yeah, the PAPS is in there. I
Hmm.
don't know.
Okay.
That's something I haven't delved into,
Explored.
but obviously I'm going to now.
Yeah, cool. Let me know. Let us know. I thought I'd just go straight to the source. Yeah. And that's just I'm just fascinated by that because there's a lot of other nutrients that our body uses a lot more of when we are glucose burning versus ketone burning.
Mhm,
So it may be that that's the case for sulfur too. I'm curious.
mhm,
And another reason why we would be so deficient, right? If we are just glucose burning in our high carb Western diet,
mhm.
most of the time, most people are in that diet. But okay, last question is it has to do with because you mentioned you really like the clean GI Janel product that you formulated. Why is it that other MSM products are less clean?
It's not so much they're less clean. I just don't know what they are. And that
Mm,
comes down to supplement manufacturing in this country,
yes.
right? I mean, it could literally be anything. If
Hmm.
buy something on Amazon, it could have a label that looks exactly like a trusted product and be something completely different. So I feel like if I'm advising someone, especially working with someone directly, and they're getting symptoms, I don't know if they're getting it because they're not taking something that's high quality,
Hmm.
or not, and so it's really hard to be able to advise and treat. And then that comes up a lot
Hmm.
online, right?
Yeah.
Like with people in other countries. And we
Right.
sort of found a workaround now where we can do like a forwarding service so we can get the GI1 powder to countries outside of the US.
Oh,
Um,
please
yeah.
tell us about this because I have
Oh,
international clients who have been asking how to get it. Yeah.
So there's forwarding services, and the main one that I found is called usatome.com. So
Hmm.
basically, you sign up with an account with them,
Hmm.
and they have a US shipping address. So then when you order, you put in that shipping address on our account, it ships to them, they ship to you.
Fabulous.
So they can go anywhere outside of the US. And right now, we're really working hard on Canada, because there's another doctor up there, Dr. Raid, who's just going wild with it. And
Good.
also, it's great to like compare notes because he's also having like similar experiences that you and I are.
Hmm.
And then we're working on Europe right now, so the EU, that's an active project. And then I got approached by, she's still a student. She's a naturopathic student in Canada, and her daughter has autism.
Mm.
And then along with that, there was a lot of digestive symptoms. She found my book, read it, and did the protocol with her daughter, and it completely changed
Oh
her
my
symptom
gosh.
picture. And she was so thrilled with it that she wants to get a manufacturing set up in Korea so
Oh,
that we can get like what we know is a third party, tested pure substance. Um, and they can
fabulous.
use it over in Asia. So
That's
that's
amazing.
pretty exciting too.
That is so exciting. Wow, that's fabulous. Well, we are at the end. Dr. Janelle, thank you so much. Is there anything else you want to share in closing today? And we will make sure to link these products of yours, especially the GI Janelle 1 powder. But I love using your formulations too of the enzymes, digestive enzymes, just supporting digestion first and foremost, keeping it very simple with supplementation at first when you're doing this and diet changes. But yeah, anything else?
Mm, I don't think so. I think we covered a lot today.
We did. Thank
Um,
you.
yeah, it might be nice just to say to the people who are asking really specific questions, on the social media portals. Um, First of all, back to that thing about I don't know what you're using,
Hmm.
and that makes it hard for me to help, as well as I'm just getting some, and you probably get this too, just really like complicated histories, and so I can't do it. I would love to be able to help, but
Yeah.
I can't. So I'm oftentimes just getting my people to direct the conversation over to a clinician.
Yeah, working with somebody because it's not just a reductionistic plug and chug kind of formula here. It's not like you have bloating, you need MSM. There's so much more involved in your health, and that's why there's the need to work with someone. And it's also there's so many more elements to healing than just doing a supplement. There's so less stress levels, lifestyle. Do you get outside? If you really want this to be your complete end to your
Mhm.
symptoms, let's take a look at the comprehensive and in working with a practitioner who can do that for you to help you focus and stay on track, stay on that roadmap. Yeah, that's awesome. Very good to say. I think there's so many of us. I did it too, all on my own, and I didn't really heal until I started seeing my own practitioner because I was just playing guessing game, and it was fun for me for a while. It was fun, but then it gets to a point where you really just want to get to the end of it. So, asking for help is not a sign that there's something wrong with you. It's just that we all need it sometimes.
100%. I mean, otherwise we would have been born on our own planets.
Right? Thank goodness we're not.
We're also an ecosystem.
Yes. Yeah. So stay connected, everyone. That's awesome. That's a good ending. All right.